Hi everyone, I'm just popping on here to say hi everyone. Just got back from my son's orthodontist appointment. My tooth is killing me. I gotta find an oral surgeon, somebody who can help me in the Charleston, South Carolina area. There's literally a hole in my tooth and it is absolute agony. I cannot take this anymore. I'm gonna pull it out with pliers myself. It's an abscess. It's terrible. And even with dental insurance, it's like ridiculously expensive. If you guys know any dentists in the Charleston, South Carolina area that will work out a payment plan with me, please, I beg of you to contact me. But regardless, I'll still be here. I'll still be doing my Wednesday upload. Tomorrow's Tuesday. I plan to probably record tomorrow since I go in so late. It's just very distracting. It's throbbing and it's so painful. I'm like down in ibuprofen like chiclets. I mean, you're not supposed to eat chiclets, but you know what I mean. You get the point. And right now I'm out of ibuprofen, so I've been taking Excedrin. It has acetaminophen in it, which is absolutely terrible for your liver, so I'm trying not to OD on Tylenol. But I'm going to pick up some ibuprofen at work tomorrow. I go in at 1:30, and I would be doing 800 milligrams every 4 hours. And eventually it won't hurt as bad, but it's like a fresh chunk is out of it and the nerve's exposed and it's absolute agony. But just, I'll keep you guys posted. If I'm able to find a dentist, I will take you on this journey to replace all of these terrible, awful teeth that I have. But I do eventually plan to have a denture placed. I would like to do the all-on-4 with the 2 screws and you pop them in so they don't fly out like you see in funny videos, which would be horrifying. Right now I've only managed to have 3 pulled. This one was pulled when I was a little girl. I didn't have a permanent tooth down there. This one's broken to the gum. This one's broken to the gum. This one got pulled. This one's broken to the gum. And this one back here, these 2 are fractured and cracked. So my teeth are horrible. Luckily, these are caps, so I'm able to talk without obvious mess mouth, you know? This is not drug related. This is called genetic decay. They start to decay from the gum line up. And every family member on my mom's side has had dentures at some point, usually by the age of 60. No natural teeth. My grandmother got lucky, the one that lived to 107. She was able to cap all of her teeth, crowns on them, and had her teeth. My grandfather always had dentures in a cup when I was a little girl, and it would freak me out. But dental pain is no joke. It is the absolute worst thing because nothing really hits. You know, nothing really takes care of that pain. I've been shoving benzocaine in these holes constantly. It's brutal. It's brutal. I need a dentist near Charleston, South Carolina, who will work with me. I do have, Delta Dental, but their max is $1,500 a year. And this is thousands of dollars worth of work. And I really need, and no, I cannot get care credit. That's just not something that I can do right now. I'm going to call the dental college at the Medical University of South Carolina, but I know that last time I checked with them, you had to be available at a moment's notice. I can pay the $200 deposit. That's not the problem. The problem is when they call you, you have to be able to go, and I have a job, and I'm just not going to be able to do it that way, but I will call and see if anything's changed, because if they can do appointments, I will definitely jump on that. But I will keep you posted because this is brutal. And if I find something out that might help somebody else, I will let you know, because I understand dental care in America is absurdly expensive. When I was little, it was like $25 to fill a cavity, and I was like $250, which is why all of these ended up not getting filled. I'm in a little better off of a place where I can pay a deposit. So I'm hoping that I can find a dentist that will help me, because abscesses and really bad teeth can affect your bloodstream. It can make you sick, and it can cause all kinds of chronic problems, which is why I think that regular insurance should cover dental work, because it can affect your whole body health. Please take care of your teeth. If you have genetic issues, obviously there's not a lot you can do about it. My gums are completely healthy. I have great gum health. The dentist that I have seen for the initial consult always told me how healthy my gums were. They can tell that I floss. They can tell that I take care of my mouth. But the kind of breakage I have in my mouth with the nerve exposure, that is not anything I did to myself. It's bad genes. So I'm very conscientious about taking my kids to the dentist from early on. I did not have that growing up. So I'm hoping that if they take really good care of their teeth and I get them regular dental visits from childhood, that they won't have to deal with this later. But it is genetic, so who knows? They might end up with the same problems, but I'm hoping not. And at least we can like cap them and do stuff we need before it gets to this point for my boys.